Hey there, welcome back to East Texas Live. Joining us in studio is Dr. Rob Dorman, a board-certified surgeon who is at UT Health East Texas, specializes in breast health, and what a perfect guy to have in for October. Tell me a little bit about Breast Cancer Awareness Month. What does this mean for a guy like you who knows how to save lives by telling people about symptoms and whatnot?
I appreciate you having me, James. It's so important for women to understand the signs and symptoms to look for because catching cancer early is one of the biggest factors that determines good outcomes. So I always ask patients when they come in to see me, have they noticed any new lumps or bumps in their breast? That's one of the first things that can sometimes pop up. Also looking for skin changes, skin redness, skin dimpling, also nipple discharge as well. Clear or yellow discharge isn't as concerning as bloody discharge can be, but all of these factors would be something that would prompt these patients to need to be evaluated by a breast specialist.
So are you a big fan of the self-test?
I am. I think that all women starting at the age of 18 should start doing self-breast exams on themselves, and they can talk to their primary providers about how to do this. What they really need to do is get a sense for what their normal feels like. So if some changes come about, they can report them and we can work them up and be sure nothing serious is going on. Also, starting at the age of 18, I recommend all patients start having annual breast exams by their routine health care provider.
Now, not mammograms, that's more like at age 40.
Right, you're exactly right. Yeah, so just starting doing the annual exams by somebody who's familiar with doing these types of exams on women is very important starting at that age as well, because they also get a feel for what is normal in their patients, because it can vary greatly between different women.
Now, breast cancer seems to be overwhelmingly a problem with women. Is that a misconception, or is it something to the order of like 98% women develop breast cancer?
No, that's a good question. I mean, the #1 risk factor for getting a breast cancer is being a woman. And so depending on race, a woman's lifetime risk is anywhere between 11 and 14%. That averages out to about 1 in 8 women getting breast cancer in the United States.
That feels a little high.
It is high. It is very high. But as far as men go, who can also get breast cancer, their numbers is more around 1 out of about 830. So not nearly as many.
All right, so it makes sense that we would focus much more on women. Is there anything they can do to decrease their chance of developing breast cancer?
There aren't a lot of great modifiable risk factors for breast cancer, as if with smoking and lung cancer, if you quit smoking, lung cancer is going to go down. But with breast cancer, you know, sedentary lifestyle, being overweight, those things can be affecting it. Never being pregnant or having a long time between the beginning of ovulation and first pregnancy, that could increase breast cancer risk a little bit. Hormone replacement therapy can be a big risk factor that could be modifiable in a lot of women. There was a study that came out in the early 2000s that showed that there was a link between hormone replacement therapy and invasive breast cancer. And once that study was known and the hormone replacement therapy prescriptions dropped, the invasive breast cancer diagnosis in this country dropped significantly as well.
That's the first I've heard of that.
Yeah, it's a hotly debated topic, and everybody should just talk about it with their healthcare providers. Just because you don't take hormone replacement therapy doesn't mean you won't get breast cancer, and just because you do take it doesn't mean you will.
Okay, well, Dr. Rob, what do the survivability rates look like today for breast cancer?
They're fantastic if you catch it early. Women who come in with smaller tumors without lymph node spread have 90% survival rates or greater at 10 years. So when it comes to breast cancer diagnosis or outcomes, timing is everything. Catching it early really matters, and that's why the mammograms are so important, which you brought up earlier.
Yeah, mammograms super important to my family. I had an aunt who a coworker found a lump, and so as a buddy system, 2 of the friends went to get the mammogram with her. She was clear. My aunt was not. Saved her life.
Absolutely.
Well, thank you, Dr. Rob. Very important stuff here. If you'd like more info on any of this stuff, uthealtheasttexas.com. uthealtheasttexas.com. Thank you so much.
I appreciate it.